All right, thanks, Ashley. And while the holidays are a source of joy and excitement for many, they can also be a source of distress and uneasiness for others. And this year, another time of difficulty for many provides a perfect storm with those grappling with substance abuse. Here today to talk about risky substance abuse and how to cope with addictions around the holiday is Dr. Craig Allen, Vice President of Addiction Services for the Hartford Healthcare Behavioral Health Network. Good afternoon, Dr. Allen, and thanks for joining us on this day.
Good afternoon. Thanks for having me on.
Always great to have you. So why can the holidays be a stressful time for those struggling with addiction?
Well, the holidays can be a stressful time for all of us. We have family obligations, financial issues, even the pressure to always be having a good time. And then on the flip side, people that don't have family and friends in the area, they can feel isolated and even more alone this time of year. But for someone who has a substance use disorder, studies show that these stressors can trigger or kindle those parts of the brain that drive the cravings and drive the alcohol or other drug-seeking behaviors that can lead to increased use or return to use.
All right. Talk about how another winter and holiday season with COVID-19 adds to the difficulty of substance abuse.
Again, we're all suffering through this, and we all have the same struggles with disruption in our regular routines and our regular lives. When that comes to someone who has a substance use problem, that might mean barriers to getting treatment, barriers to accessing recovery support groups like Alcoholics Anonymous, Narcotics Anonymous, and so forth. And so it can be particularly dangerous, the quarantines, the isolation. You know, a lot of people say in the field, the opposite of addiction is connection. And so you have to be creative to make that happen.
All right. And talk about what are some helpful tips to help people cope with triggers during this time of the year?
Yeah. Well, I think for someone who has a substance use disorder or is trying to manage their alcohol use or substance use, having a plan before you go out, before you meet up with friends, before you go to a party is really, really important. What are you going to do when someone offers you a drink? What are you going to do when someone offers you that substance and other people are using? You might want to go with someone who knows you're not using. You might want to have a prearranged time that you're going to leave and you're going to get out of there. Those are some of the things you can do. But for those who loved ones and family members who have someone who's struggling with a substance use disorder, being aware of that, being alert of the subtle and not so subtle cues, have another glass of good cheer, what's in your cup, those kinds of messages can be really difficult for someone who's trying to abstain. And it's really important to reach out and connect. So it's socialization, not the substance use that should be the focus of parties and different types of activities.
All right. Are there resources available for people who want to seek help?
Of course, there's Alcoholics Anonymous, Narcotics Anonymous. You could reach out to your primary care provider. Rushford has a number, and the Department of Mental Health and Addiction Services for the state of Connecticut. You can go to them online, and you can look up different places that can help. And you can call, and they can talk you through it and connect you with care.
All right, Dr. Craig Allen, thank you so much for joining us.
Thank you for having me on.
Always important.